All right, well, welcome back everyone for another episode of our conversations with OTDs from Concordia University, Wisconsin's occupational therapy program. I'm Dr. Megan Watry Christian. I'm the program director for our MOT and OTD program, and I'm very excited to be here today with one of our current OTD students to talk about an occupational injustice that she's been exploring. Anna, can I have you kind of introduce yourself? Tell us a little bit about yourself, when you'll graduate, maybe where you're thinking you might want to practice, and about what cohort you're in.
Yeah, so hi, I'm Anna Pace. I'm an occupational therapy student at Concordia University, Wisconsin. I'm currently in the Bridge OT program. I started in the fall of 2024. I am pursuing my doctorate, which I will be done in spring of 2027. Um, what areas that I want to go into practice? Um, that is undecided. I currently like the school setting and early intervention with kids, although I do PRN with older adults on the side as needed as an occupational therapy assistant. So I may do kids mostly, but then do a little bit with adults on the side just to keep up with practice. And I enjoy both.
Awesome,
It's
awesome.
been
Well,
a pleasure.
welcome.
Yeah. Thank you for
Yeah,
having me today. This is awesome.
yeah. I think it's so great when we get to talk to particularly our bridge students because you are practicing as an occupational therapy assistant. So you have some great like practice connections that you can make based on your experience. So, in your community advocacy and leadership class that you're taking right now, you've been exploring an occupational injustice from current events. Can you tell us a little bit about what you've been focusing on and why you became interested in that topic?
Yes. So my current project is focused on college students and mental health, specifically the fact that the mental health concerns in college students are rising on college campuses and they're struggling, and there has been limited staffing to be able to support these students on campuses, staffing shortages, limited services. Alternate options off of campus can be expensive for students when there's wait times. So these
Mm.
students aren't getting the help that they need to be successful in school. Um, what makes me interested with this topic is I have loved my college campus experiences. I was at McHenry County College in Crystal Lake, and I was very involved at the on campus with the OTA program there. I was president of Student Occupational Therapy Assistant Club, so I got to work with students that way. I was also in the tutoring center there helping kids or helping the students with formatting and answering questions. And, I was just very involved and loved the communication with people on campus. And recently, I took a behavioral mental health class just last semester, and I loved it. I connected most with it as far as taking stuff from that class and really applying it to my practice. And I really loved how it was focused on helping people to develop healthy routines and skills that they can use to improve their mental health state. And that's why I, chose the mental health topic on college campuses. And for me being a student, I also have experience with, the academic pressures. These students face, pressures of trying to do well. People in sports have the pressure of trying to do well in sports and balancing the academics. Financial strain, being able to afford school and being away from family sometimes can be hard. I'm with family, but with school, it takes me away from family outings. So overall, I understand how it can affect one's mental health. And I really want to be there for supporting these students that really are lacking, the services and are experiencing those wait times to give them the supports they need to be successful.
I love that. I think like typically developing neurotypical college age population is not a common area that OTs are serving. I am hearing a little bit more about OTs on college campuses helping with just a general population of college students, but this is really exciting because I think you're right. Like there's a lot of spaces where OT fits, like our scope fits with the challenges that college students are having, but not really a current area that a lot of OTs are focusing on. So I think this is really interesting to me. How do
Yeah,
you, oh yeah, yeah, go ahead.
so one thing that interests me too is like at MCC, I noticed there's like a success coach on
Mhm.
campus to help connect students with the right resources for studying and making sure they have the accessibility that they need. So that's something that interests me well. And I think that's one area where an OT can, push into a school is to be a success coach like that.
Yeah, awesome. Yeah, great. So So that's a little bit about how it can be relevant to OT today. What do you see in this kind of problem area? What makes it an occupational injustice? And what occupations are really being impacted?
Yeah, so the injustice is that when college students can't get the access they need to services, like the mental health services on campus, it creates an injustice as these students don't have equal access to those services to help them support their mental health needs. And when they can't improve their mental health and are having these mental health concerns, it affects their ability to successfully participate in occupations, those everyday activities one participates in, such as education, health management, taking care of their health. They can't receive those services that can help guide them towards healthy options like exercise and that may be obvious, but I'm just saying that, they can help them to talk through this, what they're experiencing with somebody. And when you can't have that, like I said, it can impact their ability to be successful in school. They can end up dropping out, not pursuing their career interests, which can affect their work. Um, Health management, taking care of their health, social participation. Sometimes when people have those, mental health concerns, their social participation can decrease. They can isolate themselves, especially when there's peer stigma involved with seeking services. That can impact one's ability to seek out and be comfortable obtaining those services that they need to get help. Um, Honestly, it can affect all of your activities of daily living, being able to get up and take a shower, being anxious and depressed can prevent you from carrying out those everyday routines, which are essential for health and well-being.
So you just mentioned anxious and like anxiety and depression. Are those the main mental health issues that are being seen on campus colleges, or are there some other diagnoses or populations that are highly impacted with this?
Yeah, so those are the main ones that I've been seeing. And in a recent study, I believe it was the American Council of Education reported those to be in the top 5 concerns in the US. Also, it was just regular stress, family problems I've seen. But yeah, mainly anxiety and depression. And those are the two that have risen in the last 10
Yeah.
years pretty significantly. And anxiety, I think, is the most common that I've seen, where depression is kind of right here with it. Um, so yeah, that unfortunately, yeah, those are the common diagnoses that you'll see, and we need to take action to help these
Yeah.
students so that they're successful.
Yeah, I think just going back to one other thing that you had mentioned, kind of and 2 questions ago is, you were talking about exercise and made the comment of like it might seem obvious, but I think for those of us who've either struggled personally with anxiety or depression, or have a family member or know someone who struggled with those diagnoses, is that's part of the challenge, is that things that seem really obvious when you're in the midst of a depressive episode or anxiety, um like those obvious things aren't obvious, right? We don't see them, or we can't do them, or we can't access those. So I think that's a really good example of how, like, we all know we're supposed to be exercising, right? But actually getting maybe the motivation to do it, or understanding when or how I can fit that in, becomes not obvious when we're struggling with a mental health piece.
Absolutely. And I think part of what as OTs we can do is we can help students try to fit those into their routines. Even if it's 20 minutes or 15 minutes a day of walking or yoga, it can be beneficial. And I agree, it is hard. Even students are aware of these services, but it's hard to take that step. And I'm
Yeah.
trying to help them to feel comfortable to take that leap.
Yeah, great. So you just talked about like kind of building in a routine of, say, exercise for 15 minutes. What do you see as OT's role in addressing this issue?
Yeah, so there's a few different ways that I feel like OTs can help. With those routines, we can help individuals try to find healthy balance in their routines. That includes time management skills, um, giving them, trying to maybe plot out a schedule for each day of what they're going to do and try to, have them stick with that schedule and encourage them, educate them on the benefits of how these tips can be helpful to them and resources can be helpful to them and how it can have a positive impact on their education. Another example is like as OTs, we can advocate, especially. Through this, there's the Legislative Action Center on AOTA, the American Occupational Therapy Association. That is a great resource. And right now, there is an action item on there that's protecting financial aid in higher education, where the budget reconciliation bill is threatening to take financial aid away in higher education. And it is very important for our profession and for our patients and for students that are having these mental health concerns. They're already facing financial strain. This will put them more into financial strain and increase their mental health concerns that they're experiencing. And then it affects their ability to afford college, limiting their ability to access OT school, and that prevents OTs from coming into the profession and helping out, which results in shortages and burnout of practitioners, which then also affects patient care, the quality of patient care.
Yeah.
Um, there's various, I mean, we could connect students to resources out there. Through this project, I've come up with some important resources that we can use. There's the JED Foundation that is a good resource. It allows students to, pick what they're experiencing and gives them helpful articles on what they can do when they're experiencing, whether it's anxiety or family or financial strain, giving them resources. The Mental Health Coalition has a good toolkit for students on healthcare tips or health self-care tips that they can use, like yoga, mindfulness, cleaning, even just cleaning up your space, simple things like that that could help students. There's a lot of great resources out there that we can help. And I think the biggest thing is helping the individual to participate in their routines and being independent and increasing their success in those activities that they find meaningful, which is a big part of OT.
Awesome. So for our listeners, some of those resources that Anna just talked about, I will link in the description for today's episode, so that if you want to check out those a little bit more, easy access, you can just click on those links in the description. Um, okay, so if you have OTs listening right now, OT practitioners, OTAs, OTRs, and they're listening and they're like, yes, I want to do something about this. What's the one or two action items that you want people to do right now?
I want them to go to the Legislative Action Center and act immediately. Like I said, this is a very good resource. It's hard sometimes to communicate with legislators on these topics, but the source provides a quick and easy way to communicate with legislators on the topic. Right now, if you go to AOTA at the Legislative Action Center, there's an action item if you scroll down to protect financial aid in higher education. And all you have to do is go to the side, and I believe there's a pre-written message that you can read through and edit and then just send it. And that will help advocate for this issue so that we can help the students keep that financial aid, to help them reduce their financial strain. And again, it also helps to increase OTs that are available to help in the OT profession. Telehealth is also an action item that has recently been up there. It's not on there now. It was recently extended, but it's threatened to be taken away from OT, and that is also very important because it decreases the access that people are, it's decreasing their ability to access services for those in underserved populations. And that would, I think, big time affect people's ability to get the help they need, especially in mental health. So, yeah, I would encourage them to go take action and at conferences, even spreading the word, national conferences. And it's important. I realize how important it is to the profession because it can negatively impact it.
Awesome. And it takes 5, 10 minutes maybe, right? So it's like an easy, AOTA makes it so easy for us to really make that connection. And I know a lot of practitioners maybe feel a little nervous about reaching out to legislators or, this is, I think, a really like maybe first step way to dip your toe into connecting with legislators. Usually, once you send that first letter, if this is the first time you've ever reached out to someone, you'll get on your legislator's email list. So you'll get updates and you'll kind of know like what is going on in their offices. And then that helps practitioners to kind of start building that political relationship with their legislators because there are so many things at a national and a state level that are, impact our practice on a day-to-day, really real level. I think a lot of times we think of legislation as like it's this high-level thing. It's not really relevant to me, but I don't know if people really understand like how much those legislation pieces impact our day-to-day practice. So that's a great idea. And again, that'll be
Yeah,
linked in the description.
yeah. I mean, it could have a real positive impact, reaching
Yeah,
out. So I encourage that.
awesome. Okay, so let's talk about kind of the advocacy process as a student. You could also connect this to your experience as an OTA. So how has this process been for you? Did you have experience with community advocacy prior to this class? And what would you say is like the thing you learned, your biggest learning thing from the course or the project?
Okay, so how was this process for you? This process was really, I mean, it was a good experience. There's a lot of pieces involved, more pieces that I originally thought was possible, to advocate on a certain topic. Um, it was motivating to be able to research a topic and then do this campaign and advocate on it, find actionable steps that people can
Yeah.
take. And to even do this and to talk about it is really motivating. Um, my experience in the past with community advocacy prior to this, it wasn't as this extensive. I've on college campus, we did a lot of awareness events for like breast cancer and backpack awareness. So those were advocacy events that I did in our society. We did like a health booth, and we're giving out fruit and helpful study tips that way. As far as an OTA in advocacy, I feel like it's an area where I need to work on, and that's why I pursued this, and I am pursuing it as a badge for my capstone, because I really want to improve my ability to advocate, and I believe that it's an essential skill to educate and advocate for important topics in the field to create change. Um, I think one thing I learned throughout this whole process is that it's really important to advocate. It is really important. Like I said, the Legislative Action Center, going there and keeping up to date on policies that are important to practice, because it can have a big impact on our profession
Mhm.
and certain populations. Um, I, it really motivates you to want to do more, find
Mhm.
more events that are happening and to spread the word, even creating like an Instagram page or an Instagram
Yeah.
account or Facebook account to like put it out there is really powerful. And so yeah, overall, I think it's just an area that I've learned that I need to pay more attention to and advocate for different concerns and events that are happening.
Awesome. I that makes me so happy as our program director because that's such a huge to me. There are so many injustices that occupational injustices that are out there, and so many different ways that a variety of populations are being underserved or, having not having equitable access, not having the resources that they need. Um, and I think OTs have such potential for empowering that change. And so that's been a huge focus of ours as a program is just helping students feel confident that they have the skills, they can talk about these things, they can make a difference, they can, here you are saying like, go reach out to your legislator. Um, when I was a student, that was not something I would felt comfortable with saying like, yeah, we should go do that and we should, like promote this and here's how you do it and it's super easy. Like, so I think yeah, super exciting for me to hear that that's happening in our classrooms and in our program. So, what's been the most challenging part of the project?
I would say the most challenging um, would be getting people to react and respond to the campaign. I've been pleased with what I've gotten so far. I
Mhm.
just wish there was a way to get more people to react and to comment and share their word. I've even thought about after this campaign sharing it like on, like I said, a separate Instagram
Sure.
account. Community is another good resource to
Yeah.
get people to interact and be aware of this topic. There's a lot of people thanking me on Facebook, which it's nice to,
Yeah.
see people dating and thanking me for bringing awareness to this topic. Um, it's hard because you have so much information to get out and you're trying just to keep it simple, and not too much information so people interact and understand the issue. So yeah, I would say that's the most challenging. Research is has been challenging a little bit too. Finding scholarly sources is sometimes hard to like find one comprehensive source that gives the list of self-care tips. They're all sporadic, just giving, exercise, yoga, mindful, there's various resources, which part of my campaign was to compile a list together of
Okay.
self-care tips people can use.
Yeah, I
Mhm.
think so for listeners, the project is designed to kind of to create a 5-day social media campaign and really related to the injustice and then like how can people impact it. And 5 days probably really, right, is not enough, especially what you're talking about. There's so much information. So like if you did want to continue on, you could spread some of those resources out and have a longer term campaign. I love the idea, of looking at how does this interact on different platforms because, you're going to hit different targets, different audiences, depending on where you're sharing out that information. And so I love that you're thinking about that. And I definitely think there's an art form to creating social media content in a way that's engaging and gets people to connect to it. So yeah, I definitely see that. What's been the best part of the project for you?
The best part of the project is being able to find resources and actual steps for students to take when they're receiving or experiencing those barriers to care. I mentioned before the JED Foundation, the Mental Health Coalition. There's the National Alliance on Mental Illness. I
Mhm.
found out that has on-campus clubs. So colleges can partner with them to have these clubs on campus to help students have clubs like to socialize and to share their thoughts and feelings. And some schools around the area don't have it. So I feel motivated to like, hey, this is here. You should reach out to this organization and consider implementing one of these
Yeah.
clubs on your campuses. The Legislative Action Center, again, is another
Yeah.
important one. You know, being able to see how I can be a part of this, and sharing resources and tips to students to help them to improve their mental health has really been rewarding. Even sharing out this way through a podcast is has been the one of the best parts of the experience too, is just overall sharing those things and realizing what you can do and what needs to be done. It motivates you to take action.
Yeah. Awesome. Awesome. So you're a doctoral student in our program. And so you're also at the very front end of kind of starting to develop your capstone project. Um, can you give us just an overview of kind of where you're thinking your capstone project might go and how it connects to what you've been talking about and what you've been exploring here?
Yeah, so my capstone project is focused on college students and mental health. So this project campaign directly relates to what I'm going to be researching and focusing on. Um, it's more focused, my project would be more focused on advocating on college campuses for students, whether it's, bringing them healthy tips or healthy self-care tips, or working with the mental health professionals and being able to help the students develop healthy routines. Um, just overall supporting mental health on college campuses in general, speaking with students, um, seeing what their needs are and helping them that way. Um, yeah, I really enjoyed the college campus experience. So I would love the opportunity to go back and be
Awesome.
involved.
Yeah, I'm really excited to see how this all kind of evolves for you. And I can't wait to, in a not that long, we'll get to hear actually like dissemination of your project back to us. So I'm excited to hear all about that down the road. So, how do you think this experience has influenced your own practice, either current practice or future practice?
Yeah, so how it's influenced my practice now is um, I realize the importance of advocacy and I realize the importance of staying up to date on important policies and actions. Um, is going to change mine is I'm going to keep up to date on the Legislative Action Center and do some research and talk with my coworkers about different topics that are an issue. And, if the policies are changing, encourage them to go take action. I'm going to take more action. Sometimes I'm even hesitant to go on that and take action,
Sure.
even though it's 5 to 10 minutes. Um, but yeah, one of my goals is to improve my ability to stay up to date on those things and to actually take action and not just think about it.
Yeah.
Um,
Awesome.
share it with people that I know. Yeah.
Awesome. Okay, so before we wrap up, I
Mhm.
have two questions that I ask everybody who comes on, and I didn't give these ahead of time, so they're kind of off the cuff. But what area of life or practice do you think OTs should have a bigger role in? And it doesn't have to be related to anything else we've talked about today. It can if you want, but it doesn't have to be. So just anything you think OTs should be doing more or that we should have a bigger role in.
Well, I think that definitely relates to my topic. I think OTs can have a bigger role on campuses in working with mental health professionals, collaborating with them to help them give students different tips for routine. Like we focus on healthy routines and time management and all those different skills to be successful in daily activities. We can share our expertise with mental health professionals, or even if there's a role on campuses where we can be on there and have different classes or workshops that we could spread our expertise to students. Holding a yoga class or, like health workshops would be great. That's where I see it mainly, because you said at the beginning, it's not really a setting that you see us in,
Right.
COPs in. So I think we could make a big impact on college campuses.
Awesome. Awesome. Okay, last question. What current occupation brings you joy?
I would say that leisure occupations bring me joy. I really like reading. I like going boating with my family on the lake. It's very relaxing and peaceful. I can't wait to do it this summer.
Yes.
We're going. So, yeah, I would say spending time with my family and friends, with people, those are the main ones that bring me joy.
Awesome. Well, thank you so much for spending time and sharing about this today with me. I've learned a lot, but also then with our audience. So thank you so much for your time today, Anna.
Thank you for having me. It was a pleasure, and I really enjoyed the opportunity.